Hi, and welcome to Pharmtoberfest, the University of Georgia College of Pharmacy, which celebrates American Pharmacist Month. Today, we are interviewing pharmacists who play different roles in the health of our community, and we're fortunate to have Dr. Merrill Norton, who has practiced addiction pharmacy for the last 35 years. Good morning, Dr. Norton.
Good morning. How are you doing?
I'm doing great. Well, first of all, we want to know why you think it's important to celebrate American Pharmacist Month.
Well, one of the major things I think about pharmacists is that they are the glue that holds the healthcare team together in their communities, in the clinics, and in the hospitals. They're in the center of activity from the differentiation of diagnosis, prescribing, and then being able to look at the medications and then being able to dispense and distribute those medications to nursing staff, patients, families, etc. It's a great opportunity for them to celebrate the success of what pharmacists do, even though it goes a lot of it unnoticed, of how many successful interventions, medication interventions they do every day in this country that prevents adverse drug effects. And so I'm real excited that they are able to celebrate American Pharmacist Month in the way that we do.
Thank you. And also, why and how are pharmacists an important part of recognizing substance abuse?
Well, I came to academia after, I guess, 25 years of being an addiction pharmacist and found very quickly there's a very limited number of individuals in pharmacy that actually had the know-how to understand how to effectively intervene on someone who has a substance use disorder. So by doing that and coming to the University of Georgia, which is been a great experience for me, we developed curriculum, and then SBIRT was included in physician training and nursing training, and now it's in pharmacist training. And one of the things I can't tell you is how the resource of a community or hospital pharmacist with doctors, physicians, patients, families, of being able to give the appropriate information on how and what to do for someone who needs help with a substance use disorder. I am doing a talk this afternoon having to do with opioid treatment programs and the importance of pharmacists being able to manage adverse drug effects. I mean, there's so many opportunities in pharmacy today to assist someone to do that. And as long as we can continue to work and expand how they do that, I think, again, as I said, they're the glue. They are where people come with those questions. And I think that's an extremely important component of pharmacy practice.
Well, in your time, these past 35 years practicing as an addiction pharmacist, how have you made interventions for your patients?
I was talking to the student ASHP chapter day before yesterday, and they asked me a similar question. I have probably had over 25,000 patient interactions. What you do is go to them with an open and kind of a hold the individual innocent and help teach them the disease state they're suffering from and what they can do about it. I think that we have been able to do that not only in regular populations, but I've also, one of my greatest joys, I guess, is that I've had over 1,000 pharmacist patients that we've been able to successfully intervene, refer, and treat. And I think today, if I look at the numbers of individuals, we've probably been successful in over 90% of those interventions. And so it's important that practicing pharmacists have that know-how of what to do, when to do it, and where to refer. And that's what I'm hoping that we'll get to in our next project, is to be able to develop an app on the phone for pharmacy so they will know where appropriate facilities are in their regions throughout the state of Georgia. And so it's one of those things that I think is important for us to do, is to continue to work on how do we get someone better.
Well, what you do is so important, Dr. Norton, and we greatly appreciate your service. So happy Pharmtoberfest.
Well, thank you very much. Appreciate it.
Thank
Take care.
thank you.
Hey, my name's Daniel Rogers, and I'm a co-chair of Generation RX here at UGA, along with Mohit Kumar. You just heard from Dr. Norton about a pharmacist's role in treating substance use disorder, and I want to tell you something simple that you can do. Every day, approximately 5,000 children ages 12 and older misuse a prescription painkiller, sedative, or stimulant for the first time. Something you can do to help decrease this number is disposing of your unneeded medications, and that's what we'll be telling you about today.
Hey guys, so you just heard from Daniel about some substance abuse background information, and really quickly, I'm just going to walk you guys through the trifold that we would usually present at Pharmtoberfest. So first of all, what is GenRx? GenRx is just an educational program that increases public awareness of prescription medication abuse and encourages healthcare providers, community leaders, parents, teens, and college students to work against it. So in summary, we're basically just trying to prevent abuse and misuse of any type of prescription medications. We collaborate with pharmacists, educators, community outreach programs, and many other local organizations. So one of the most common questions that we really work to address is how can you dispose of unwanted or expired medications? So there's a lot of ways you can. Some of the easiest ways where you don't really have to do much would just be going to like a drug take back event. A lot of places will host these. Some pharmacies might, a police station, a fire station, anything like that. They also have drop boxes, which we will get to later in this video, and we'll show you where you can take them in Athens specifically. But if you aren't able to go to one of those areas or you're not in close proximity, we are also going to discuss some ways you could dispose of these medications at home. One of the most common ways would be you could just take a bag, like a Ziploc bag or something. And if you have kitty litter or coffee grounds or anything like that at home, you could toss the medicine in there in the bag, and then you could cover it with kitty litter or coffee grounds. Then you would just mix that around, and then you could throw that in another container, another Ziploc bag, and then you could just throw that away in the trash and dispose of any of the prescription labels by shredding them or also putting those in the trash. And then on the sides over here, we do have a lot of additional education links in case you guys were interested in other topics, such as where can I learn about drugs that are commonly misused, and you could go on the left hand side to the National Institute on Drug Abuse. If you look over at the top right hand corner, you can see that there's a question that says, if I suspect a friend or family is misusing prescription drugs, how should I intervene? What should I do? So there's a lot of educational resources up there that you guys could take a look at as well. And then over in the very bottom right hand corner, it says, where can I find help for a prescription medication misuse problem or addiction? And you could either call that phone number at the very bottom of the screen or go to that website. And again, there's just a lot of information there. We thank you all for joining us today and hope you enjoy the rest of the video.
So another way you can dispose of your unneeded medications is you can mix them in with some used coffee grounds or kitty litter. So you'll take the medications and you'll dump them in with the used coffee grounds, and then you'll put that in a Ziploc bag and throw it away.
Okay, so today I'm going to be showing you guys how to use DisposeRx. So the first thing you want to do is you want to cross out all the personal information on your label. Then you want to fill it up with 2/3 of warm water. Then you're going to apply the powder in there, and then you're going to shake for about 30 seconds. Once you've shaken for 30 seconds or until the tablets have been completely dissolved, it's going to look like this. And now it's safe for you to toss it in the trash.